This is a lung biopsy, which consists of a few strips of cells or a few strips of tissues. Sorry. And you can see in this tissue there's a very busy with cells. And if you take a closer look into it, there are some cells that are arranged in cords and also cluster. For example, at the center part over here, so you can see there's some cells forming a gland or tubular-like kind of a structure. Take a closer look. So this tubular structure is actually a glands-like structure, or it differentiates into glands, and these glands are lined by these atypical cells, which shows mild to moderate pleomorphisms, as you can compare with the size of the nucleus. There is some variation of the size and also the variation of the shapes of the nucleus. Here's another groups of cells which form tubules or glands. You can see at the center there's some sort of secretion that had been secreted by these glands. In the other part of the tissue or fragments of tissue, you can see there's these similar cells forms a cribriform structure. Cribriform means a solid kind of a structure with a lot of holes inside it. So these holes is actually glands, lumens, and to confirm that, you can see at the center there a few lumens that are formed by these cells, and these lumens contain some secretion within it. Same goes as over here. You can see there's a lot of secretion going on, and these cells, these atypical cells, form a cribriform kind of a structure. Up here you can see there's more well-formed glands. In which majority of it forms sort of a cribriform kind of a structure. So with some secretion inside the lumens, within the cribriform structure. And the rest of the stroma that surrounds these cells or these glandular kind of configurations show desmoplasia or desmoplastic reactions. So desmoplastic reaction is there's an increase in the production of fibroblasts and also fibrocytes which surrounds these cells. So this indicates malignancy of the nature for this tissue. So again, over here you can see there's normal respiratory linings, respiratory epithelial linings. It can be seen over here. It is a pseudostratified with cilia epithelium. So you can see the cilia at the end of the epithelial lining there. The cilia is usually pointed toward the air spaces. So the function of the cilia is to remove all the phlegm and also the mucus that are produced by the respiratory glands, and remove it from the airway or air spaces. Right now we're going to see some immunohistochemical staining for this tissue. We start with the CK7 or cytokeratin 7. This is the control. So we take a look at our tissue. CK7 will be positive in cells that arises from the lungs, thyroid, the upper GI tracts, and some might be positive in the genitourinary systems, but in this case it's most probably from the lungs, because this biopsy is actually taken from the lungs, and it's appeared to be adenocarcinoma of the lungs. And this CK7 supports pointing or going towards lungs in differentiations. Okay, so you can see clearly all of these, the previously malignant cells or atypical cells, pickups or being stained by cytokeratin 7s in this staining. So it's nicely stained the cytoplasm and also the membranes of the cells. So it highlights the one that looks like empty spaces there. At the center there is actually the nuclear part of the cells. To convince our diagnosis, we also do the TTF1. So the TTF1 is actually pointing toward a few organs. So this is the control. The control is usually taken from the thyroids. And this is our test. So you can see in our tissue, diagnostic tissue, the TTF1 is positive at the nuclei of all the cells of all of the malignant atypical cells that previously we seen in the biopsy or HNA stain. So you can see this TTF1 is positive. So it's nicely, moderately stains the nucleus of it. So you can see this is already 40 times magnifications. I don't think we need to go any further, because any further magnification you need to use oil emission. Alright, here again, another part of the biopsy. You can see that this tumor also shows or stain positive for TTF1. Okay, and lastly, because of this tumor looks like it forming some sort of adenocarcinoma kind of features which form glands, so we need also to rule out any kind of tumor that arises from the elsewhere. And the most common tumor that can have or has the adenocarcinoma configuration is from the GI tracts. So this appendix, this is the control. Don't take it as positive for our test yet, because this is just control. So it's lining the top most layer of the appendix. So in the biopsy that had been obtained, so almost all of the malignant or atypical cells does not being stained by CK20. So this is CK20. CK20 is usually positive in adenocarcinoma of the GI tract or the colon. So this is negative. No tumor cells or no malignant cell pick up the stains. Right, so that's how does the adenocarcinoma of the lungs look like in histopathological biopsy.